Super helpful.
Wonderful. That's great. And you always.
Nice to meet you. I've heard you speak.
You have.
And one time in particular, something about presenting when you first started. Really impressed.
Yes, people American Heart Association.
I volunteered to tell me that.
Oh, you are. Well, thank you. That's not easy.
Okay. Good afternoon, everyone. Wendy, you'd like to open up?
Yes.
Make sure the microphone's near you.
Okay, sorry. I hope everyone can hear me. Good afternoon and welcome, everyone. My name is Wendy Mano, and I'm a proud New Yorker who lives in Forest Hills. I come from a family of New Yorkers. My father and mother were both born in New York and always lived here. Unfortunately, my parents grew up in a time when young people thought that smoking made them look older and sophisticated, and the dangers of tobacco were not publicly known. My mother and father both started smoking in their early teens and smoked heavily for over 65 years. My father was diagnosed with heart disease in his 60s, and after undergoing 2 angioplasties for blocked arteries at age 67, his kidneys failed. His addiction to smoking kept him from quitting, even when it was so obviously affecting his health. Several years later, he suffered a heart attack, and I watched him get weaker and weaker from congestive heart failure, emphysema, and impaired kidneys until 6 weeks later, he passed away. He only stopped smoking when he became too weak to smoke. He died because of tobacco use. It's been 9 years, and not a day goes by that I don't still miss him. My mother was diagnosed with lung cancer in 2003 and had to have one section of her lung removed. Even lung cancer and surgery didn't get her to stop smoking. Her addiction was too strong. As a result of her cancer surgery, my mother has dealt with lung infections for the past 10 years, and now she needs oxygen 24 hours a day. Just this past year, my family experienced another tragedy because of the tobacco industry. My father-in-law was a longtime pipe smoker. He developed COPD, and eventually his lungs stopped functioning, and the doctors could no longer help him. His tobacco addiction destroyed his lungs and weakened his heart. Watching him struggle to breathe in his last days was truly heartbreaking and something that no one wants to or should have to experience. Mayor de Blasio, Commissioner Bassett, council members, thank you for helping to protect New Yorkers from this type of devastation. My sister and I have spent hundreds and probably thousands of hours over the years dealing with my parents' smoking-related illnesses in hospitals, doctors' offices, and at home. This was time that should have been spent enjoying healthy, fun family time together, time that we can never get back, time their grandchildren missed with them. As a soon-to-be grandmother, the good news, the happy news, I look forward to your success in protecting young people from ever having to experience the same tragedies. And now allow me to introduce the person who will help get the job done, Mayor de Blasio.
Thank you so much, Wendy. Wendy, I just want to say I'm sorry you had to go through all that, and obviously your loved ones had to go through it. And I bet if we asked everyone in this room, most of us have a story, I certainly do, of the people in our life who grew up in that time, as you said, when they were being told all the time it was okay, it was cool to smoke. And even the years since, there's still too many people who unfortunately have ended up in the clutches of tobacco, and it just has a devastating impact on people's lives. And I appreciate you coming forward to tell your story, to make clear how important it is to fight this.
And it is.
It is indeed, and we will. I want to thank our hosts as well particularly Kathy Kaufman, who's the Senior VP of the American Heart Association. Thank you, Kathy, and to all your colleagues for hosting us and for the important work you do fighting this scourge, and you've been in the forefront, obviously, for decades. And we're here to talk about the things we're going to do to take the next steps in the city in this fight. But I also want to note up front the members of my team who are here and thank them for their work. Deputy Mayor for Health and Human Services, Herminio Palacio, Commissioner for Consumer Affairs, Lorelei Salas, Finance Commissioner Jacques Giha, our Sheriff, Joseph Aceto. You're going to hear from some other folks in a moment, obviously, including our Health Commissioner and our council members who are here, who are sponsors of key pieces of legislation. And I want to thank some other partners as well, the American Lung Association, the American Cancer Society, and the Campaign for Tobacco-Free Kids. All of them have extraordinary records of fighting big tobacco and helping to turn the tide. But there's still more to do, and that's what brings us here today. Look, unfortunately, even after all the fights, after all the years, after all the victories, big tobacco is still very strong in this country, and big tobacco is public enemy number one when it comes to public health. We have a lot more we have to do. And unfortunately, sometimes when you're fighting an enemy, you think you've won only to find that that enemy takes a new shape. We're going to talk today about some of the new pernicious realities like e-cigarettes that are causing a whole new set of challenges. And we're going to talk about how the tobacco industry is once again using the techniques of decades ago to hook people on a product. Smoking is, I'm happy to say, through the efforts of all of the folks I mentioned earlier and so many others, smoking is down dramatically in the last 15 years in this city. But there's still 900,000 New Yorkers who smoke. That's way too many. And too many are dying young as a result. The examples you just heard are not, unfortunately, rare. There's still too many people, too many families going through this. Right now in New York City, the top 5 causes of death overall in this city: heart disease, cancer, pneumonia, respiratory diseases, and stroke. What do they have in common? All of them can be linked to tobacco use, every single one. Tobacco causes 1 in 3 heart disease deaths. And that's part of why we are here today at the American Heart Association, to make clear that linkage. What we're going to do now is move forward on a plan that will hit tobacco hard on many different fronts and address the problem of smoking in a variety of ways that are going to reach down to the grassroots of this city. It's a package of 5 bills we'll be working with our city council colleagues to pass. And I know that when we pass these bills, they will reduce smoking markedly and they will save thousands of lives. The goal overall, this package, is to reduce the number of smokers in New York City by 160,000 by the year 2020. It is an ambitious goal, but a necessary one. It will bring us down to the lowest rate of smoking we would have ever had in our history, 12% of our population. And as with all initiatives in terms of health and safety, that's not an end point. That's our goal for the next 3 years, and then we intend to go farther after that. I want to say up front that my predecessor, Michael Bloomberg, did extraordinary work in terms of fighting smoking and taking on the tobacco industry, and New York City has led the way on so many elements of this fight. And with this new package of legislation, we're going to go to an even higher level and be able to show folks all over the country the next things that are necessary to do to take on this challenge. Now, I want to be clear what we're up against: a multi-billion-dollar industry, a very strong industry, a very agile industry. It should have been long ago knocked back on its heels, but they keep coming back in new ways. And that's why we have to go at this problem with a whole variety of tools. and we have to be very, very aggressive. So the package before us. First, licensing of e-cigarette retailers. You're going to hear today from my colleagues just what a problem e-cigarettes have become and how they've become a gateway to the use of tobacco products. So I'll say up front to anyone who harbors the illusion that e-cigarettes are a fine alternative, they're not. They're dangerous because they are addicting unto themselves and unfortunately for too many people are just a step on the way to tobacco use. We're going to license e-cigarette retailers the same way we license traditional cigarette retailers. Now, here's a statistic that should shock everyone. According to the Surgeon General, e-cigarette use is up 900% amongst high school students in this country, just in the 4 years from 2011 to 2015. That's a shocking amount of growth. In this city right now, almost 16% of our high school students, according to a Department of Health survey, are smoking e-cigarettes. And Dr. Bassett will tell you about the nicotine and the dangerous chemicals in those e-cigarettes. Now, again, if there's any illusion that somehow e-cigarettes are better or they're okay, they're not okay because of what's in them already and the health challenges that they present unto themselves. They're not okay because they are clearly being used and end up being used as a gateway to tobacco use. But just to be clear that the industry knows that, and there is a clear strategic linkage. They're trying to get people, particularly young people, to become addicted to e-cigarettes so they will ultimately use other products as well. And they're literally borrowing the same advertising approaches of the time that you heard about before, 50, 60 years ago. And here is an example you see on these easels behind me, but I'll hold one up just to make it easier. Here is a cigarette ad from the 1960s. This is a star of the television series Gunsmoke, promoting L&M cigarettes and talking about how they are healthier than they were. And here is an e-cigarette ad from the brand Blue. And you can see just an updated version, exact same thing. The guy who would be regarded as cool and admirable, and the cigarette in these instances somehow complete the man. That's what's being pushed here. But what's so shocking is, as a society, nothing has changed. Just as bad. Just as much trying to play on people's emotions and hopes to get them to partake of a dangerous product. And if you look at the easels, and you can take a look afterwards, it's just striking. There's almost no difference in the approach, no matter how much information came out over the years of the dangers of smoking. This industry is shameless. Again, just to make the point clear, more and more, the e-cigarette industry is the tobacco industry. Major tobacco giants are buying the e-cigarette brands and promoting them. It's not a disconnect. It's now a coordinated strategy, more and more. So we will go at that through a variety of means, including licensing. And I want to be very clear that we're going to have to be very aggressive because big tobacco is spending billions. They're spending billions of dollars on advertising like this. They're spending billions of dollars in a systematic effort to addict people. So I'll make the point even more bluntly. You can make a parallel here to the kind of serial killers we read about tragically in the news. And we see each and every time they follow a pattern. Well, big tobacco is following a pattern, convincing young people in droves to partake of e-cigarettes, knowing that for so many of them it will be the pathway to traditional cigarettes and potentially a lifetime of smoking with all the dangers that come with it. We want to draw a line here in New York City to stop that through licensing, through public education, with every means we have. The second item of the plan raises the minimum price of cigarettes and tobacco products, and it is clearly one of the best ways to drive down use, particularly among young people. Raising the minimum price of a pack from $10.50 to $13, that is the highest price floor in the nation when we achieve it. We think that alone is going to substantially reduce smoking, and we will be also the first in the nation to be setting a price floor on other types of tobacco products as well. Third point, we'll be reducing the number of places that sell these products. Fact that's quite striking, there are 29 times more tobacco retailers in New York City than there are Starbucks. So it's everywhere. Tobacco is everywhere. It's just too easy to get. We're going to change that by capping the number of licenses available in each community. Fourth point, and this one makes so much sense, it's amazing that it's still a reality in our society. There are pharmacies that sell dangerous products. There are pharmacies that sell cigarettes and other tobacco products. There are pharmacies that sell e-cigarettes. Pharmacies that are supposed to be the place we turn for health. Pharmacies that are more and more are supposed to be helping to take care of the whole person, the whole family. On the other hand, they are selling a dangerous product that's making people sick. It doesn't make sense. If you are in the health business, you shouldn't be peddling a product that kills people. It's as simple as that. Now, I want to tell you, there are some good actors, and you're going to hear from great gentlemen who will talk about what a lot of the smaller and family-run and independent pharmacies have done of their own volition, and I want to commend them. I also want to say there are some big companies. CVS is a great example. CVS made a decision 3 years ago to stop selling tobacco. I want you to know this was a very brave decision. It probably meant about a $2 billion loss in annual sales. But they did the right thing, and they stayed true to the mission that they were supposed to have as a company. Unfortunately, there are other businesses that aren't following that same moral imperative. Major pharmacy chains like Walgreens, Duane Reade, and Rite Aid still sell cigarettes and tobacco products, giving health with one hand, taking it away with the other. We believe they could follow the lead of the independents and CVS and just do the right thing right now, but if they're not going to, we'll work together to pass this bill to force their hand. Finally, fifth point, last point, we need to encourage folks to ask the right questions. If they're thinking of living somewhere in particular, what's the environment they're going to be in, their family's going to be in, will it be healthy, will it be safe? People have a right to know if they move into a building to live what the rules are related to smoking. Now, we understand by law that landlords have the right to allow smoking on private property, but tenants also have rights, and they should know what the ground rules are if they have to expect that they'll encounter secondhand smoke, and that may cause them to think that's not a place they want to live. And they'll put pressure, market pressure, on landlords to create stronger policies. These 5 elements of the plan will fundamentally change the reality. And there will be a fight over this, I guarantee it, in the coming months. This legislation is all about to proceed in the council. You'll hear from my colleagues in a minute. There will be a fight over it. And Big Tobacco watches New York City very carefully. We're obviously the biggest single market in the country. So expect a fight. And we know historically they've stopped at nothing. But we are resolved to beat them and to turn the tide here in New York City. A few words in Spanish. 900,000 neoyorquinos fuman. Este vicio es la causa de demasiadas muertes. La industria del tabaco hace todo lo posible para crear más adictos a sus productos. Pero nosotros estamos luchando en contra de esto. Hoy anunciamos 5 proyectos de ley con el concejal municipal que reducen el uso de tabaco y salvan vidas. I mentioned I was going to introduce to you someone I really appreciate and admire. He's the owner of a pharmacy in Staten Island called the Super Health Pharmacy, and he lives up to that name because of the choice that he has made. It's my honor to introduce Mayank Parikh.
Thank you, Mayor de Blasio, for the opportunity to speak about this issue. As a healthcare professional that has seen firsthand the negative effects of tobacco use, I know how important this fight is. I'm honored to be standing beside you today. As a pharmacist, I'm fortunate enough to be in a profession that is expanding its scope of practice daily. However, our roots and mission stay the same, which is to provide the information and medication that our patients need in order to live a longer and healthier life. That is why one of the reasons why I became a pharmacist, to help folks spread knowledge and to educate others on how to live a healthy lifestyle. And it's a job that allows us to establish a level of trust with our patients. That's why I've always felt that I had an obligation to inform them about the dangers of smoking. And one thing I've learned in doing that is that when it comes to tobacco use, information makes a difference. Conversations make a difference. Incremental changes make a difference. Because at the end of the day, sometimes all people need is a push to help them quit. Just to share a personal story, I once had a patient not too long ago, a 2-pack per day smoker, a man with a family, children, and half of a life still ahead of him. And each day with each cigarette, he was killing himself. Not because he wanted to or didn't know the risks, not because he was weak or didn't care, but because he didn't know how to begin to quit. In the end, all it took was a conversation to send him down the right path. We came up with a plan for him, set some manageable goals, and week by week, we cut down his daily use. When we had finally cut it down to 1 cigarette per day, he came up to me and told me he was finally ready to quit. And he did. We're all very proud of him. And this is why I am honored to be here today, Mr. Mayor, because I know firsthand that every little thing makes a difference when it comes to helping people quit smoking. And to start, making cigarettes and tobacco products harder to buy will definitely make a difference. Close to 90 to 95% of independent pharmacists and pharmacies have already discontinued the sale of cigarettes long before people were even talking about it. And I applaud everyone who has followed suit. As a pharmacist, I have always been astonished by the fact that the same places that provide essential cancer treatment medication can also sell the very thing that leads to cancer itself. As healthcare professionals and fellow leaders of society, we should not be selling a product that knowingly kills people. More than that, though, it's contradictory to our mission as pharmacists. How can we say with a straight face that our only priority is to help our patients live longer, healthier lives while also selling cigarettes? The answer is that we can't. Doing so erodes the trust and credibility that we need in order to do our jobs. And it was the trust that allowed me to have that conversation with my patient about quitting in the first place. So ending this practice will be a huge step in the fight against tobacco use, and I applaud you for making it happen. If we come together and form a united front on the danger of cigarettes, we will definitely save many lives. These new regulations will save lives, and I hope so that this will now become part of a larger conversation. And thank you for allowing me to be a part of it.
Thank you. Really want to express my admiration for the way you've approached things and the way you treat your customers, or you say your patients, which is the right way to think about it. But I know that you and a lot of other smaller pharmacies gave up a lot of money, bluntly, by making that decision. But you put the health care of your customers first. So I just want to thank you. It's really admirable the way you've handled it. Now, someone who feels this matter very passionately and spent a lot of her professional life fighting this battle and been a big part of the success here in this city, our Health Commissioner, Dr. Mary Bassett.
Thank you, Mr. Mayor. And thank you also to our hosts today, the American Heart Association. As all of you know, cardiovascular disease remains the leading cause of death in our country, our state, and our city. Thank you to the Deputy Mayor for Health and Human Services, Dr. Blasio, and my fellow commissioners who have worked with the Health Department on this as well, Commissioner Salas, Commissioner Jiha. To the Health Committee Chair, Councilmember Johnson, Council Members Lander, Cabrera, thank you very much for bringing us to this day. And Councilmember Torres, I believe, is not here, but we are also very grateful to him. And of course, the advocacy community, some of whom I expect are in the audience today, who have been so important to the public health progress in tobacco control. It really has taken a lot of people to bring this package together, and the Health Department is extremely excited to have reached this day. It's hard to imagine that it was only 15 years ago that it was almost acceptable that 1 out of every 5 adult New Yorkers smoke cigarettes. But through concerted, sustained government action, that proportion fell from 21.5% to 14.3% today. It's been a remarkable achievement, but we still have, as the mayor has noted, 900,000 adults in New York who smoke, 15,000 youth in our city, high school students who smoke. And we know that about a third of current smokers who, if they continue smoking, will face death from a smoking-related condition. So the risk over a lifetime is real and substantial. So what we're here today talking about is saving lives. This package of bills built on the same general strategy that the Health Department has promoted for a long time. We want to make it easier to quit and harder to smoke. And these bills do exactly that. They do it by limiting availability and accessibility. You've heard about the limit to retail sales. Pharmacies will no longer sell cigarettes. Retail tobacco licenses will be capped and set at 50% of the current level by community districts, and no new tobacco licenses will be reached until we fall below that 50% line. New York City has a very dense collection of retail outlets. We have some 9,000 of them. We expect that over a period of 10 years, we will get well below 6,000. So we also are reining in e-cigarettes, and the mayor has talked a lot about the explosive growth of e-cigarettes and the absolutely rapacious behavior. I mean, we've talked together often about microbes and lower life forms, but today we're also talking about some lower life forms in the form of tobacco companies. And the marketing of these products is so clearly aimed at youth. It's by the flavorings and the use of popular figures that it's definitely a replay of an old playbook. We've also talked about price. The importance of price as a public health tool for tobacco products has been recognized for a long time. People don't buy products as the price goes up. It limits consumption. And the laws, as you'll hear, are going to be setting minimum prices, raising it for cigarettes, setting it for the first time for other tobacco products. And we are very pleased that people will be getting more information that they need in residential buildings to protect themselves from the secondhand smoke so that they at least know what the smoking policy is in a building. I was 16 years old when I went into a pharmacy with an 18-year-old friend and bought my first pack of cigarettes. And I smoked for another 15 years. That won't be possible anymore in our city, and thankfully in a growing number of cities across the country. So we are here today talking about advancing the health and well-being of all New Yorkers, saving lives, preventing tobacco-related illnesses, saving money, because these preventable illnesses are costly to care for. I want to thank the mayor again and the council members and all those people who helped make this possible. Thank you, Mr. Mayor.
Thank you, Commissioner. Now I want to hear from the 3 council members who are taking the lead on these key pieces of legislation. I want to start with a crucial partner in this effort because he is the chair of the Committee on Health, and he's worked with us on so many important initiatives, and want to thank you, council member, for that. Also the sponsor of Intro 1544, which sets the price floors and hit some.
Smoking is still one of the most preventable health crises that our city faces, and we need to treat it as the grave threat that it is. And as you heard, when it comes to our city's anti-smoking efforts, there's good news and there's bad news. The good news, as was already said, is that smoking rates have fallen to record lows. The 2016 Mayor's Management Report show that 14% of New Yorkers are smoking, which is one of the lowest rates on record. The bad news, as you heard, is that 12,000 lives per year are being lost by smoking-related illness, and that is unacceptable. I want to just say that I'm someone that struggles with this. And it's hard to even talk about that and say that because I have a lot of shame around that. I have been clean and sober from alcohol and drugs for almost 8 years. July 13th, 2009 was the last time I drank and used drugs. But I have not been able to quit smoking. It's been hard. I've quit, and then I've gone back, and then I've quit, and then I've gone back. It was easier for me to quit drinking and using illegal drugs than it has been for me to quit smoking. I mean, and it was hard to quit drinking and using drugs. But I did it, but it has been much, much, much harder. Nicotine is a real thing, and it's not just the physical effects that it has you in, but the mental vice that it grips you in these stories you tell yourself about taking a break, about needing a moment to yourself, about slowing down, about just having an outlet. So for me, it's personal, and I don't want to stand up here today and be the chair of the health committee and talk about all these important bills and not be honest about my own struggle as it relates to this, because that would be hypocritical and dishonest. But it's a real thing, and I can't speak for all smokers because I'm sure there are some smokers who are happy they're smokers, but I'm not proud of the fact that I struggle with this. I mean, I'm not proud of it, and I'm not proud of the fact that I've tried to quit many, many times, and sometimes have been successful, and other times have not been successful, and have gone back and forth, and I beat myself up, and it's a constant thing, and I am in no way blaming this on the people around me because I take responsibility for my own actions, but, you know, my father smoked 2 or 3 packs of cigarettes a day. Growing up when I was a child and a teenager, and he'd smoke in the house, he'd smoke in the car, he'd smoke wherever we were, and there was constantly smoke around me, and I told myself that I was not going to become a smoker because I didn't like that, and I didn't like being around it. And unfortunately, we see that happen, which is if you are around secondhand smoke and you have parental figures and other role models in your life who are smoking and you're around them as a child, it's just a fact that folks that are around that become smokers at a higher rate. So I'm not going to continue to recite the statistics, but I do want to say that I think this package of bills is very, 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 very important. Councilmember Lander's bill makes total sense on getting this out of pharmacies and similar establishments. My bill to increase the minimum floor price for cigarettes up to $13 from $10.50 today and create a minimum price for other tobacco-related products is a huge step in the right direction. And Councilmember Cabrera's bill on licensing e-cigarettes is sort of uncharted territory, and it's really important that we take action in this area. And lastly, I just want to say that I remember when you could smoke in bars and restaurants, and when it was, and the mayor was a member of the city council when it was pushed forward to get rid of that, and how controversial it was at the time. And I think if anyone tried to talk about bringing back smoking in bars and restaurants, there would be a revolt in New York City. But there was a fight back then on that. And the right thing was done, and it has saved countless, countless lives. Last year, Mayor de Blasio was a supporter, and we took smokeless tobacco out of Yankee Stadium and Citi Field here in New York City. This year, opening day, just last week, you see Mets and Yankees who are not chewing tobacco on the field. It's not being broadcast nationally. There are always ways we can improve. We have to adapt as this big industry that the mayor talks about adapts and marketing these products to children and to adults, and that's what this package of bills does. I'm going to keep working on my own issues on this. It's uncomfortable to be honest about this, but I think it's important to be honest about it. And lastly, I just want to say this, Mr. Mayor. You, since you came in 3 years ago, Dr. Bassett didn't tell me to say this. You, since you came in 3 years ago, have done a lot to increase the budget for the Department of Health and Mental Hygiene. And under the previous administration, who did a lot of great stuff on public health, because of the Great Recession, the health department was cut tremendously, hundreds of millions of dollars. And you have really steadily brought the budget back up for the Department of Health and Mental Hygiene. And we've worked on Ebola together. We've worked on Legionnaires together. We've worked on all of this health insurance together. And now we're working on anti-smoking efforts together. And I think it's really important. We have the best public health department in the world. We have a great health commissioner. In this budget, they need more money. He didn't tell me to say that. She didn't tell me to say that.
Wow.
But you have been great already. But we need to keep increasing because the health of New Yorkers is so important, and I'm really grateful to be here today. Thank you very much.
Thank you, Corey. Corey, thank you. I think it's very important. I admire your honesty, but it's really important for people to be reminded what a grip nicotine has on people. And in a world of too many addictive challenges, how supremely addictive this particular chemical is and what it does to people. So I think it's admirable. I'm sorry it's been a struggle, and I believe that you will overcome it the way you've overcome the other challenges. But this one is different, and we have to treat it even more aggressively as a result. Thank you for your leadership. And now I want to turn to someone who's a council member but has another job too. He's a pastor and therefore knows plenty about working with people on their personal realities and their challenges and the things they're trying to overcome and the things that they struggle with. And so you clearly understand with something like e-cigarettes how this is creating a whole new set of problems, particularly for young people. And so as the sponsor of the licensing bill for e-cigarettes, I want to thank you, and sponsor of Intro 1532, Councilmember Fernando Cabrera.
Thank you so much, Mr. Mayor. Thank you so much for your leadership in this issue. And thank you for starting today's press conference with Wendy's testimony, because it hit home. I lost not one, but two grandfathers to cigarettes. My earliest recollection of a funeral was when I was 5 years old, and watching my cousins going to a hearse and banging on that window of that hearse and saying, abuelo, abuelo, grandfather, grandfather. It marked me to the point that my experience was a bit different, Corey. I vowed never to touch a cigarette, but ended up working in a rehab program for 3 years and directing that rehab program. And Mayor, you are so correct. This is a gateway drug. Let's keep it real. It is a gateway drug. The people that I worked with used to tell me it was more difficult to quit cigarettes than it was to quit heroin or crack. It was amazing, the testimonies that I was hearing. So I stand here very proud, and also the advocates that you know who you are. You make us better in regards to this issue. So like tobacco retail outlets, e-cigarettes sellers are more numerous in low-income minority neighborhoods like mine. I represent a district, it's the third poorest councilmatic district. Increasing health disparities and giving the impression that vaping is acceptable Experts, including the New England Journal of Medicine, the Partnership for Drug-Free Kids, warn that e-cigarettes act as a gateway drug that can lead to drug addiction. According to the Network for Public Health Law, between 2011 and 2015, e-cigarettes use among teenagers increased tenfold. In 2016, the U.S. Food and Drug Administration mandated that e-cigarettes be regulated as tobacco. Centers for Disease Control and the Prevention and the Center for Disease Control and Prevention and the Surgeon General of the United States have found that local licensing programs are highly effective in preventing the use of e-cigarettes by youth who are more likely to choose e-cigarettes over tobacco products. So we're trying to protect here the next generation of young people. My bill, Intro 1532, requires licensing of e-cigarette retail dealers. Currently, 15 states and the District of Columbia require a license to sell e-cigarettes. More local governments are restricting access to and use of e-cigarettes as the dangers of vaping are more widely recognized. As a former substance abuse counselor and director, I recognize these dangers. We must take leadership now to prevent more addiction by restricting access to e-cigarettes. This is an important first step in protecting the health of New Yorkers. We are acting now to prevent addiction, reduce health disparities, and to save our youth from the dangers of vaping. And I want to say to my colleague, Corey Johnson, now that it's going to be $13.50, now you have a big incentive to quit. I think this is going to be your moment. Thank you so much, Mr.
Well
Mayor.
said, well said. Finally, I want to introduce my council member from my community, and he's been a leader on a number of issues, and in this case, leading the way on the tobacco ban in pharmacies, which I think is going to be a huge piece of this, and once and for all say a pharmacy should be a place for health only. Thank you for your leadership. Councilmember Brad Lander.
Thank you, Mr. Mayor. It's an honor to be here with you and Chair Johnson and Councilmember Cabrera, and I want to say a special thank you to Dr. Bassett, who's been a big educator for all of us on these issues, and for me, and to the American Heart Association and the advocates have just helped us see, I think all of us have those stories of someone in our lives. Seeing it in the big picture is also really powerful. I think the commissioner talked about the fact that something like a third of people who smoke wind up dying as a result of the health effects of smoking. So if we get 160,000 fewer smokers, we're saving more than 50,000 lives. And it's not every day you get to be part of doing something in public policy that saves a whole lot of people's lives. So this is not lost on me, and I feel really humbled to be a part of it. So thank you. I have two bills in this package, both designed to reduce the number of places that you can buy cigarettes and tobacco products. It's not surprising, but there's a lot of good evidence that shows the ready availability and the just near presence in the lives, especially of kids, but of everyone, makes it much more likely that you start smoking. I'm the father of a 17 and a 13-year-old. I watch where they hang out with their friends, and it's on the bodega, the corners of New York City, right? They're where we live. They're certainly where our kids live. And when you're hanging out in places that have ready availability of cigarettes, the likelihood you start smoking just is dramatically higher. There's some estimates that it's twice as likely that you're going to start smoking if you're regularly in places that sell cigarettes. So we've got to do something to reduce it. So 1547, by reducing the number of licenses in half, by 50% over time, will significantly cut down on the ready availability of cigarettes. We'll do that by each time a license is given up, we won't grant a new one until in each community district we're at half the number where we currently are today. So we don't, with the exception of pharmacies, we don't take it away from anybody who has it. But when a bodega closes or hopefully decides to stop selling, we won't grant a new one until we've cut the number in half by community districts. That'll still leave many more places you can get cigarettes than Starbucks, unfortunately, but will have a real significant impact. And starting with pharmacies for all the reasons you've heard, and I want to give big props to Mayank for his leadership. Mr. Mayor, our Near Guard pharmacy in Park Slope, both the 5th Avenue and the 7th Avenue branch, long ago decided not to sell cigarettes. So most of our independent pharmacists don't. CVS has shown you don't have to as a big chain. So you've got a big chain pharmacy that has shown it works. So there is just no reason that the other pharmacies that continue to sell cigarettes, especially the big chains the mayor mentioned, Walgreens, Duane Reade, and Rite Aid, and the small number of independents that still do. It's about 550 pharmacies in the city. So out of those 9,000 places the commissioner mentioned, 550 are pharmacies. This bill will stop the hypocrisy of being a place of health that sells the #1 product to undermine your health, and will start us on that path of significantly reducing the number of retail outlets that sell cigarettes. That'll mean fewer smokers, fewer kids that start smoking, and over time be a big part with the other bills in this package. I'm also really enthusiastic about the other bills in this package, the e-cigarettes, and Chair Johnson, you know I'm a fan of legislation that sets a minimum price for products we want much less of. I was only going for 5 cents. But cigarettes kill, so it seems to me that $13 is the right way to go. So, thank you.
Thank you for that historical perspective. Okay, we're going to take questions on this legislation, this proposal, and then we'll go to other topics as well. Anna.
Eric Garner was killed because he was selling loose cigarettes. Why, how would this bill stop people from selling loose cigarettes, or are you guys thinking that that might increase too?
I think that's a different challenge, honestly. I'll turn to Dr. Bassett. We're trying to address a number of pieces of equation. And again, my predecessor did a fine job going at key pieces of this, like getting cigarettes out of bars and restaurants. We have to keep employing a whole host of new strategies to keep driving down the amount of smoking. But I don't know if what our best approach is on that question.
Sure. I'm going to take that question as not a question about policing techniques, but a question about the problem of the illegal sale of cigarettes that are untaxed. And that is a concern that, of course, we have, that we share with the Department of Consumer Affairs and the Department of Finance, which are responsible for the enforcement of both taxes and the correct handling of tobacco sales. We will, for the first time, have a license that covers both cigarettes and tobacco sales, and we'll have a license that, as Councilmember Landers just explained, will be in the situation that if you lose it, it's gone. So we expect that the fact that the illegal sale of cigarettes by stores can result in the eventual revocation of a tobacco license will help ensure that people adhere to the guidance and the legal requirements for tobacco sales. So we expect that this will successfully reduce the sale of unstamped, untaxed tobacco products in retail outlets, which is a principal setting for the sale of untaxed, illegal sale of untaxed, illegally imported tobacco products.
Okay, other questions? Laura.
If I might ask a two-part question. One is, if you raise the price floor from $10.50 to $13, what would be the actual price of a pack of cigarettes in New York City? Because does that include the state excise tax and the city tax? I know that those are all components.
Well, I'm happy to answer it. I just wanted to defer to the council member who's built.
We're all deferring to you, Mary.
The minimum price, as Councilmember Johnson would explain, and thank you for giving me the chance to answer the question, sets the price. So at $13 a pack, New York City will once again have the most expensive pack price in the nation. That means that you can't sell a pack of cigarettes for less than that. It doesn't, it includes, that price will include the various taxes, which also are still in effect. But it basically just sets the price. You can sell a pack of cigarettes for more, but not for less.
And then if I might ask the second part, do you have data or can you give us statistics about what New York City's smoking population looks like by income level? I've seen some concerns from people that increasing prices in this way could be unduly burdensome on low-income New Yorkers who maybe smoke more than wealthier New Yorkers. Who smokes by income level?
Sure. You're right to point out that there are demographic variabilities in who smokes and who doesn't in this city. Men are more likely to smoke than women. Probably the most important determinant is education level, with people with less than college education and less than high school education being progressively more likely to smoke. And that, of course, educational level is often a correlate with income. We don't see the kind of variability by race, for example. Well, blacks and whites have about the same smoking rates in our city. You're framing cigarette smoking as though it's a benefit. And I just want to make it clear that true, it is a regressive tax in the sense that it's a flat tax. No matter what your income is, you presently pay the same tax, or the price is a flat price, or it can't be lower than $13. So, but for people for whom this will be an incentive not to smoke, I say that's a good deal.
Go ahead, Jillian.
Yeah, just to kind of follow up on Laura's question, I mean, is there a concern, though, that if lower incomes already aren't stopping people from smoking, which is an expensive habit, I mean, I guess how much data is there to show that making cigarettes more expensive will make those people stop smoking, or will it just make them have less money in their wallet?
Let me start and pass to Dr. Bassett. Look, we have to remember there's a whole series of tools being employed here. So, you've seen the very vivid advertisements the City of New York sponsors to show people what the effects of smoking are, to make available help. If someone wants to quit, there are a lot of ways to get help, and they are, free and available. That doesn't mean it's easy, and Corey's testimony is powerful. It's not easy. But I want to be really appreciative of the history in this city of really illustrating the problem, but also making a solution readily available. And that would obviously be true in our whole public health apparatus, which is huge in this city. And also by changing the culture, because we're all affected by the culture around us. So by making smoking less acceptable, less pervasive, less available, all of these things do affect behavior. To the previous point and yours, we want to use every tool we have to convince people to stop smoking, even if it's tough. And price is one of the things that dictates human behavior. So take it from there.
I think you framed it exactly correctly. And there really is every reason to think that everybody who's a smoker can successfully quit. Many people attempt many times. It may, for whatever personal experience may be of value. I certainly quit many times. I smoked until I was a doctor in training, so I certainly knew better. But eventually, most people who attempt to quit do succeed. And the city has worked very forcefully to make nicotine replacement therapy, which greatly increases the likelihood that your quit attempt will be successful, readily available to people, working in concert with the state.
Marcia.
Mr. Mayor, can I add one
sorry.
thing here?
Go ahead, Brad.
I just would encourage people to remember that helping people quit not only saves their lives, but also saves them a lot of money. So a great way to help low-income people be less low-income is to help them quit smoking, and there is a lot of evidence that a higher price does that.
Go ahead.
Money. If you're increasing the cost of a pack of cigarettes by $2.50, will the city be able to increase taxes so that it will go into city coffers, or will the people who sell the cigarettes get an extra $2.50? And if that's the case, are you at all concerned that there might be a black market or people who try to evade the law in order to sell them cheaper?
Sure. On a couple answers, and then my colleagues may want to jump in. We've been down this road, sadly, too many times, Marcia. If we had the power to make our own tax policy, it would be very, very different in this city. And we don't, unfortunately, in the vast majority of areas, we have to go to Albany for approval. We do have the ability to price set in different ways. Now, the reason I'm at peace here is we've seen these price increases drive down demand. And so it clearly nets out in favor of health. And ultimately, the more you drive down demand, the more you put big tobacco out of business. So, you know, it's one of those things in life where you choose sometimes a means to get to an end that may not be perfect, but it's towards a good goal, and we know it works. But if we had the ability to tax ourselves, we would do that, and then we would put that money into good uses here. On the black market question, sure, there's a huge black market. It's a big problem, and we can talk about some of the enforcement efforts. The finance department, sheriff's department, consumer affairs is a very, very aggressive enforcement effort, and it's growing. But it's a big problem nonetheless. And a lot of those cigarettes come from out of state, from jurisdictions that don't regulate as much as we do. And it really does create another challenge to public health that, you know, a certain number of cigarettes are getting through that are not at the price that discourages people. But that doesn't stop us from recognizing if you can go at the place that most people are buying, let's face it, most people are buying through normal legal means. If you can go at that, make it less appealing to people, that makes a big difference. Do you want to add, or anyone want to add?
The only thing that I would add to that is that the fact that the tobacco licenses will be capped, and that if you lose your tobacco license because you have been selling untaxed cigarettes or selling to minors or selling flavored cigarettes, you will not be able to get it back. So in that sense, we're hopeful that we'll have more good citizenship on the part of people who hold retail tobacco licenses.
So could you lose your license if you're selling it below the $13 price?
Yes.
Yeah, and I want to note.
And not even, I mean, it's a process, not it's
right, not overnight,
instant,
but
not
yes,
overnight,
that is the ultimate penalty. And I want to note again between the sheriff, consumer affairs, finance, that they are in a position to exact a lot of fines as a result of this legislation, serious dollar figures, and again, in some cases, as high a penalty as removing the license or even putting a business out of business. So it's very serious stuff. I think the sheriff wants to tell us a little bit about this.
Hello. Yes. Yes, certainly. I'm a little short, so maybe it's a good idea to stand up. Yeah. Okay, so first off, my name is Joe Facito. I'm the sheriff of the city of New York. I have been with the sheriff's office for 30 years, and I first have to say that we have done more cigarette tax enforcement in the last 2 years than we have in the history of the department. We've done very, very big things, and we've used, as the mayor said, different tools in the toolbox. Unfortunately, a lot of the problems in New York City start outside New York City. So one of the things we decided is we were going to gather the data from our strong regulatory inspections. So we go out, we inspect locations, we have the right to look at their inventory, their stock. If they're found having untaxed product, we have the right to make an arrest, we have the right to make a seizure. There's felony level, there's misdemeanor level, and there's a whole series of tax penalties. But that's not the only answer to the problem. That's one piece of it. In our dialogues with the individual store owners, we develop leads on where are the trafficking, where are the networks that are moving the cigarettes into New York City. We feel that that's very important. The question about Eric Gardner, that's a small, localized issue. We want to stop the flow coming into the city, and we go to its source. So last year, we ran a major investigation in Virginia, where we had a network that was shipping anywhere from 7,000 to 10,000 cartons of cigarettes a week. We had deputy sheriffs from New York City go down, work with the sheriff in Virginia, do surveillance, electronic, physical. We did seizures, we did search warrants, and we shut that network down. That network was costing the city and state over $24 million in tax revenues. That was one network. And we do 4 to 5 of those types of investigations a year. So we have a very aggressive policy that consists of regulatory, criminal investigation, and finally, strong civil tax penalties. If you are found with untaxed product, there is a civil tax penalty that gets docketed as a tax warrant. We've placed liens on real property. We have directed the sale of property, the seizure of property, and we are continuing to use that combined strategy to tackle these issues. So all of these new pieces of legislation will piggyback on what is already existing and in place. We're going to use the same staff, and while they're looking at the cigarette product, they're going to look at the OTP product, they're going to look at the other aspects of it, and then we work jointly with the other agencies. We're not in a vacuum. This is not a silo. We only look at the sheriff items. We contact DCA. We tell DCA what we found. DCA tells us. We do joint inspections with DCA. So we have very, very strong proactive approaches to enforcing the city's tax law.
Excellent. Thank you. The sheriff's in town. Thank you. Who else? Go ahead.
Do you have any numbers on the sales of cigarettes in the city and how you expect them to decrease the money?
Who's got it?
I don't have the answer to that question.
Damn good question.
It's a good question.
We will get you a
We will
follow-up
get
on
you.
that. Go ahead, Melissa.
Packs of cigarettes within, the overall sales in New York City are actually already selling at $13 or above? Because I know smoker friends who complain that they're already paying $14 a pack. So how many cigarettes?
You mean just like a retail decision to do that on their own?
People complain you already can't get cigarettes.
It really depends on the part of the city.
The amount was set based on driving up the average price by about 20%. So on average, it's higher by 20%.
Marcia's question, because I was going to ask about that too. Is there any scenario in which the difference to get to $13 is not made up by increased taxes and therefore does end up in the pockets of the tobacco companies?
Yeah, Mary, you want to describe, again, we don't have direct taxation authority. So Marcia's question, which I commend, points out the unfortunate reality, we don't have the taxation authority. If we did, we would do this as a tax. It's a price increase. It's a mandated price increase. Companies, unfortunately, do get that money in, but since we're driving down demand, we think it nets out in favor of both health and ultimately knocks down their customer base.
That's right.
Did I get that? Okay. Grace?
Okay, so just to recap, so the companies,
Let's recap.
The retailers keep that money from the increased prices, right? Nothing's returned to the city or to any smoking cessation.
No, because it's not a tax in that sense.
In terms of NYCHA, I know that at the end of last year, I believe the federal government said that all public housing needed to be smoke-free in 18 months. I'm wondering if the city's doing anything on a faster timeline with NYCHA, and since you're the landlord, you wouldn't necessarily need to wait for legislation to pass. You could go ahead and make those changes now.
It's a big change, and it's something we're committed to, but we're on the timeline that was dictated by the federal government. If anyone has any specifics to add, I welcome them. But by and large, look, this is it's a very extensive set of rules. We're going to spend a lot of time educating people and preparing them for the change. We intend to implement it fully and on time, but I'm not, at this point, not sure we can do it earlier than the schedule laid out. Okay, way in the back.
Mr. Mayor, I'm wondering, or anybody on the panel there, what the current status of the requirements for anti-tobacco education is in city schools, and if there was any discussion in this legislation about upping that?
Anti-tobacco education in schools. Okay, I'm not expert on that. Anyone want to speak to that? All right, unless anyone can speak to that. We're going to get back to you on that one, too. Willie.
A very similar package of measures was presented to you in the second half of 2015. A year ago in March on ESPN, you said regarding anti-tobacco measures, we're putting forward another package of measures in the coming weeks. If it's an issue of saving lives, as people in New York are dying every day because of tobacco use, why wait so long to do this?
Because of the balance of priorities that we had to deal with. Since we came in, focused on opening up whole new veins in the fight for health and safety. Obviously, Thrive NYC in terms of mental health, Vision Zero in terms of reducing traffic fatalities, everything we've been doing to drive down murder and other tragic outcomes in terms of crime. We were balancing a lot of factors. We were doing a lot of work with the council on a number of fronts as well. and including things that were beyond the question of health and safety, but other crucial public policy areas. And it was a question of sequencing everything. We knew this was important, but we had to get it right, and we had to get it in the right sequence.
I don't understand what that means, sequencing.
It means there's a lot going on.
You didn't have the bandwidth to do more things?
Again, you're talking about legislative process, and you're talking about the work that has to be done to perfect each package and make sure it's ready to be achieved in the council and implemented. It's literally a matter of sequencing. As soon as we thought we could get it done the right way, we were ready to do it. Go ahead.
How many users of e-cigarettes go on to use regular cigarettes? And can you talk about the math of how you arrived at $160,000? I'm sorry, 160 fewer smokers.
So the data on e-cigarettes are that about 16% of high school students report that they've smoked e-cigarettes in the past 30 days. Adult usage is much lower. It's something like 6%. And many adult users also are tobacco users. But your precise question, how many are going back and forth, I'm not aware of any data that would help us answer that. It certainly is true that somebody who uses e-cigarettes is becoming addicted to nicotine, and that if they're unable to locate an e-cigarette, they will buy tobacco products to address their nicotine cravings. You asked about how we came up with the idea that if we move from 14.3% of New York City adults as smokers to 12% would be 160,000 fewer. It's a back of the envelope calculation. I can show it to you.
If I can just follow up, you guys said that e-cigarettes are a gateway drug to regular cigarettes. Can you back that up with statistics saying, well, X percentage of e-cigarette users go on to smoke standard traditional cigarettes?
What the mayor was describing was a marketing strategy that looks exactly like many of us who are old enough remember tobacco products being marketed. There are some people who make the case that e-cigarettes are a cessation tool. But if you look at the marketing, this is not trying to get people to take up e-cigarettes as a way of not smoking tobacco. This is a strategy of trying to glamorize a form of nicotine addiction. Additionally, the industry has invested heavily in e-cigarettes with the major tobacco companies, Reynolds, Lorillard, Philip Morris, owning e-cigarette companies. So I would describe this as an inference that is plausible, and it is extremely worrying, the fact that we've seen this explosion of use of e-cigarettes, along with all the marketing clearly aimed at youth, trying to encourage them to use e-cigarettes, suggests that it is a plausible concern.
Yeah, and just to put a point on from everything we know of the e-cigarettes so far, they're dangerous unto themselves. Obviously, more study is being done because they're fairly new in our world, but the nicotine is clearly addictive. There's other chemical elements that cause a lot of concerns about health. And then the crossover that we see happening and we're concerned about. But we can also put together other backup information to show you how some of that conclusion was reached.
Some of this is, we have no idea what it means to be a 15-year-old who smokes e-cigarettes and smokes them for the next 50 years.
They haven't been around.
Because they haven't been around. But why should we run that kind of natural experiment?
Member Lander, a question?
Please.
Under your bill capping the number of bodegas, et cetera, that would be permitted to sell cigarettes, tobacco products, what happens if a bodega sells to somebody else? Does the second successor bodega get the license, or it goes to the cap?
If it's a change of business and ownership, you don't transfer the license automatic. Let me let the Consumer Affairs Commissioner give the answer to this question, as they give the licenses. So she's going to get it more accurate than I am.
Well, actually, if the business is in good standing, the license could be transferred.
And it would not factor into the cap.
Right. It would not.
And what is the cap number, Commissioner Salas?
The cap number is going to be calculated at 50% of the current number, today's number. Is it by health district or community district?
Community
by
district.
Community district. So.
What's the current number?
Well, it's about 9,000.
It's over 8,000 and change. Sorry?
What are the criteria for losing your license?
Yes. So there are a couple of violations that can trigger revocation of a license, like unlicensed activity and sales to minors. So if you are found guilty of violating these laws within a period of 3 years, 2 of those violations can trigger revocation.
So if you have a license and you do everything right, you can't lose it?
Right. You will not lose it.
Unless you're a pharmacy, in which case the other bill will reduce those.
Okay, let me go. Anyone who has not had a question yet, go ahead. Yep.
About the pharmacy thing, can you talk a little bit more about how you would encourage, like Dwayne Reed or Rite Aid, who gets a lot of money from these cigarettes, to get rid of selling them?
Well, by making it illegal. I mean, I think that was the
That's one way.
encouragement we thought we would provide. There has been a campaign. Look, CVS got a lot of love for doing it, and people did follow up and say, and I think that maybe the American Heart Association or other advocates could talk about this. CVS was persuaded it was the right thing to do. There has been pressure on the other big chains to do the same thing. They have not. We're proposing to do it by legislation.
So in other words, persuade them to do it, if not make it illegal?
No, the legislation proposes to make it illegal.
No, it's just, go straight to illegal. I do think it will have a pressure effect that if, the end is near, maybe they will seek salvation and they will suddenly reform themselves, and any day sooner is good for everyone. But no, this is straight up. It's going to be a legal mandate.
And hopefully they will choose to do that beyond New York City, right? CVS decided to stop nationwide. Our law will only cover New York City, but I sure hope that it will help encourage the other chains to stop selling them.
By the way, for anyone who needs B-roll, isn't there a Dwayne Reed in the ground floor of this building? So you'll be able to see, you'll be able to see plenty of cigarettes.
That's a good one.
Right there at the quote-unquote pharmacy that sells cigarettes. Go ahead, Rich.
Mr. Mayor, have you ever smoked cigarettes?
No, my dad, unfortunately, as you heard everyone else's stories, my dad was 2 packs a day, Winston's, Marlboros. It was horrifying to watch, and definitely had a huge, horrible impact on his health. And I could see it progressing over the years when I was a kid. So, no, I'm in that group that was, scared straight to never even try one. And my brothers are the same way. Everyone was deeply affected by the experience. Who has not gotten a question? No, way back.
So just to clarify, the city doesn't have any plans to try to reach out and have any conversation with these big pharmacies before pushing the legislation. It's just you're introducing the bill, and that should be the pressure.
I'll start, and then my legislative colleagues can jump in. I think that, they got the memo a long time ago that this is a bad thing. They consciously decided to keep doing it. The independent pharmacies overwhelmingly made the decision, even against their business interest, to get rid of cigarettes. CVS very commendably made a decision. I think the time for persuasion is over. It's time for a more forceful solution.
I'll just add here, the bill was introduced a while ago, and there was follow-up with the other chains after CVS stopped selling, so the threat has been out there while persuasion has been trying to take place, and it's time to move forward with the legislation.
You praised former Mayor Bloomberg for all the work he had done on this issue. Did your administration have any conversation with him or with Bloomberg Philanthropies, given all the work they continue to do on this issue?
I have not. Now, the health department, obviously a lot of folks in the health department have been here the whole time through. I said when I ran, one of the areas I most agreed with Michael Bloomberg on was public health. And so we've kept a lot of the same approaches and a lot of the same personnel. So I don't know if there's been an ongoing discussion with the philanthropies. But right off of his strategies, that deepening of the public education efforts continued. And the notion was we were on a track, we were continuing, as you heard from Councilman Johnson, we've gotten down to our lowest rate ever at this point, but it's not enough, and we've got to go a lot farther, and that's what sparked this. But we'd be happy to work with them. Mary, speak.
Well, as the mayor mentioned, when I was worked with the health department before, I was the deputy commissioner responsible for this part of the health department's work, and I was just recollecting this morning that we came up with the idea of a retail reduction strategy. Gee, it must be nearly 10 years ago. So the the long game is very important in public health. So here we are today, but there have been no direct conversations with the Bloomberg philanthropies about this. I'm sure they'll be very happy to read the newspapers.
Let me see if there's anyone else who's not gotten a question. We'll go around for round twos. Round two's Anna.
The tax, the 10% tax, state law allows that as long as the money does go to public housing. Is there anything stopping the state from doing what they did with the bag fee and just saying, like, screw you guys, we're going to change legislation so you can't do this
They
anymore?
didn't use those exact words, but it's a little more genteel.
Maybe to you.
This is, to be fair, this is the piece that is an actual tax is allowed. It's something we, by law, have the right to act on. There are a few of those taxes, which that's a different matter. I think I'm not an expert. Maybe my colleagues want to speak to it. It's a different matter when something has been long since adjudicated as city purview, versus I think the situation with the bags was more unusual in that sense. But it's also a very small amount of money in the scheme of things.
This is a state housing law.
You want to speak?
So, yes.
Hold on. Stand up.
Yeah, it's the state housing law. It's 1935. It's already in the law. So no, it's already in the law. No, they could always.
Yeah, but let's be clear. I'm going to hold on one second, Jacques. He can fill in the more blanks. There's a bit of apples and oranges here. A 1935 law that has continued unabated versus the situation with the bag fee was a standalone thing not based on that kind of previous precedent. So, yeah, anything could happen, but it's a very small piece. Jacques, what kind of dollar figure are we talking about comes in off of that in this scenario, what we're talking about here? It's pretty small, right?
It's very small, about $1 million.
$1 million. So I'm not sure it's where people in Albany are going to put their focus. Who else? Grace.
Timeline for the legislation in terms of when you hope for this to be passed?
I'll start, and the experts can speak. It would definitely this year, and the sooner the better. I know there's work that has to be done in the council and a legislative process, but I think there's a lot of momentum too.
The plan is to hear these bills in the coming weeks, so not even the coming months, but there will be hearing on these bills sometime very soon. One of the bills, Councilmember Torres' bill, hasn't been introduced yet. The other bills have been introduced. His bill is going to be introduced, I believe. I don't want to speak for him, but I understand this is going to be introduced at the next stated meeting of the City Council. So then we can hear the package of bills after that. I think the next stated meeting is April 25th, I believe. And so I think the Health Committee hearing on this will either be the very end of April or the very beginning of May. And given that it sounds like we have support from the administration and the advocates, and I don't see much opposition to this in the council, there might be some tweaking that goes on after the hearings, depending on what advocates say and depending on what the public says when they show up. But I think that these are bills that would probably be on a fast track to get done, hopefully before the summer.
Okay. Well,
follow up the two elements of this. First, Dr. Bassett, you said the 160,000 was derived by by setting the goal of reducing adult smoking to 12% of the population from 14.3%, and that's by 2020. Was that number simply chosen arbitrarily, that 12% target, or
it represents?
It suggests you can get there.
There's a national standard.
It's a national goal, one that we also aspire to.
But for all of our education, who set the national standard?
The national standards are were set in a document called Healthy People 2020, which is a document that puts forward numbers of public health goals by Health and Human Services.
12% of the adult population?
Correct.
Is there any reason based on this that you think you can get there in 2.5 years?
I think as part of a comprehensive package of tobacco control efforts that the mayor has described that includes support to cessation, the ongoing hard-hitting advertising, and this new package that we are on track to achieve it.
And then the other follow-up was this new tax tax on other tobacco products, I didn't understand if you were saying that would raise $1 million annually, and that income is supposed to be dedicated to the housing authority. Is there any stipulation over how the housing authority would use it?
None in the law that I'm aware of. This, as you've heard, is a very old law that was put on the books in 1935 under New York State housing law, and it stipulates that there can be a tax by a local jurisdiction. As you've heard, this is something that is a very precious ability for local jurisdictions, and that it has to be earmarked for public housing, so that the tax that accrues through this mechanism all goes to NYCHA, and it doesn't specify how they have to spend the money.
Okay, last call. I'm sorry, go ahead, Joanne.
Sorry to belabor this, but I just want to triple check. So if a retailer is already selling a pack of cigarettes for more than $13, nothing would change at that retailer in terms of the price, correct?
That's correct.
Correct. It's 13.
Choose to increase the price above $13.
Right. I know some do already.
$13 is the minimum price for a pack of cigarettes. If this bill passes, presently it's $10.50.
And the difference here, so currently the selling of cigarettes is licensed, but e-cigarettes is not yet licensed, and this would now pack that and other forms of tobacco into that license, or?
2 licenses, one for e-cigarettes, the other for tobacco. And added to the cigarette license are all other tobacco products. So that includes cigarellos, cigars, smokeless tobaccos, snus, etc.
Licenses would go together, or they would be,
Well, not everybody who sells e-cigarettes is interested in selling tobacco products. The head shops, for example, don't sell tobacco products, but they sell e-cigarettes. So they would just get an e-cigarette license.
So we're talking about 4,000 licenses for e-cigarettes. I don't know if that math is the same as half by community board, but approximately half by community board for e-cigarettes and half for.
So there's no licensing now for e-cigarettes. So basically the e-cigarette rule is people would have people who sell e-cigarettes have to stipulate that they have to prove that they're selling e-cigarettes and apply for a license within a certain amount of time.
But it's not capped, I guess.
It will be at that point when that time elapses. That's it.
Let's have them go over it with you separately, go over the details, but just, I see one more question over there. I want to say this. I think the speed with which the e-cigarette phenomenon grew is part of the issue here. I will say, when I first heard about it, I didn't understand, was it healthy, unhealthy? Was it a tool to get people off of traditional cigarettes? What was it? And by the way, there's another area where the marketing, I think, has been clever. They've sort of tried to make people think this is a kinder, gentler, form of cigarette. And it's a kinder, gentler, dangerous thing is what really turns out that it is. It gets you, obviously, nicotine addictive, period. Bunch of chemicals that the FDA has still not fully analyzed what they're doing to people. I asked the question of Dr. Blasio and Dr. Bassett, for those who might argue it's a tool to get off smoking, what would you say? And they say, well, if it was a tool to get off smoking, unlike the gum, unlike the patch, which went to the FDA and got approval as, something that would help people, lo and behold, the e-cigarette industry never took that step, never even pretended it was something health-oriented. It is not FDA approved in that sense as a tool to get off of cigarettes. So I think there's a lot of mystery. I think there's a lot of, as Dr. Bassett said, we don't even know what the long-term health impact is because it hasn't been around that long. We do know the growth of usage is explosive, particularly among young people, and that's why it was important to quickly get some regulation in here. And I think we can also safely say we're not expecting a whole lot of new regulation from Washington nowadays on health and safety matters. So cities like New York and states are going to have to step up because I think it's going to be the wild, wild west on health and safety for a while. And we better do what we can do to protect our people. Yeah.
The only thing
Please,
I would add to that, Mayor, is the growth is surprising but not accidental. As you have pointed out,
Right.
The growth is very intentional, and we need to stop it.
Right, and backed by a vast industry. Please.
There was some legislation in the city council regarding hookah bars and the regulation of that. Can you speak to whether you support that regulation and where it is right now and why it's not part of this package?
Yeah, we need to act on that next. There's no question there's real challenges there that have to be addressed too. So these are up first. That will be soon behind. Obviously, we got to work with the council, and there are issues that have to be worked through. But my intention is to get that moving with the council soon after this is resolved.
What are those issues that need to be worked through?
I think it's a lot of grassroots concerns about impact on business, which I always appreciate. Meaning I understand that's a real concern, but I'm going to argue vociferously that health and safety come first. There are also concerns because there are some connections to people's historic cultures, and there has to be some sensitivity on that front. But again, part of making sense of what goes first, what goes second, what goes third is to say, okay, these, and my colleagues can comment, I think these went through a lot of work. Sure, there will be some real questions raised, and there'll be concerns raised from communities that have to be worked through, but these are ready to go. I think hookah is not yet ready, but hopefully will be soon.
Yeah, we had a hearing on hookah almost 2 years ago, and I know Councilmember Gentili has been one of the major folks trying to get this done. Councilmember Rodriguez had some bills on this as well. And I know the health department, I don't want to speak for them, they've been working with those council members to try to adapt the legislation in a way they thought could actually fit what is currently going on right now. I support both bills in concept. I'm sure I'll support both bills as they're amended, and the Health Committee is ready to pass those bills as soon as there's an agreement between the Health Department and the City Council.
I'll just add that I think doing these first, and especially the license reduction bill, sort of is the right order on this. A concern I had was I've signed on to those bills, but I wasn't initially a sponsor till we got this one in play because you could see it as targeting a particular community given the cultural connections, but because we're doing this citywide as part of a broader effort, also doing it in the hookah bars, I believe, will make sense next.
Okay. Last call on these topics. We'll go to other topics. Going once, twice, other topics. Okay.
So is there anything stopping you guys from issuing new licenses? Because the 50% cap is only starts when the bill goes into law.
Is there anything stopping us from issuing it, or are we choosing to? I don't know what the answer to that is. That's a good question.
Right now, there's no cap on tobacco licenses in New York. So anyone who signs up and applies,
people have a legal right.
They have the right to it.
The answer.
Not issue them?
Until the law changes, we are obliged to continue to follow the law.
Stopping a bunch of people from rushing to get licenses before the cap goes into
Well, they have
place.
to qualify. There's still standards they have to meet. But yeah, anything like that is always a concern when you pass new regulations.
It's a little different for e-cigarettes. I should clarify. You have to prove that you are currently selling e-cigarette products in order to be eligible for the license.
Go ahead, Marcia.
Challenge you in court on the constitutionality of limiting people's ability to sell a product?
I'm not a lawyer. It's theoretically possible, but I would argue just common sense. Tobacco has been highly regulated, that it would be a really hard argument to make on any of the tobacco-related pieces. If you said with e-cigarettes, which again are increasingly dominated by the same tobacco companies, could they say, well, no, this is not that? I think nicotine really kills their arguments right away. I think the fact that, the addictive element in tobacco is present in e-cigarettes, and there's such a clear history of regulating tobacco, I don't know how they'd win that one as a armchair analyst. I don't know how they'd win that one. And certainly our lawyers have looked at these pieces of legislation very carefully and feel very comfortable that they are on strong legal footing. Okay, other topics. I see a hand way back there.
Mr. Mayor, I wanted to get your just general response to the levels of lead that have been found in public school drinking water, but also ask you, apparently, there's no requirement. One of the Department of Education's responses is that there have been no cases of lead poisoning found in school kids, but there's no requirement to test kids above the age of 2 or 3, I believe, and so I'm wondering if the city or the Department of Ed would consider doing some tests just to rule that out.
Look, I think I have to frame this for a moment. Any question about children and their health is a valid question. But in your paper, there's been efforts to make a linkage to the Flint situation that is just absolutely unfair and inaccurate and alarmist. Doesn't serve anyone. You're talking about apples and oranges in the highest degree. In Flint, the entire water source caused pipes on a widespread basis throughout an entire city to corrode and poison people, and it was proven en masse. Here we have a situation where our schools have been highly monitored for years and years. We've had a huge amount of testing over years. There's been even more testing lately, but that doesn't mean there wasn't a lot of testing before that. We have not seen any incidence of a problem across the board, let alone on any scale like the horrible tragedy in Flint. And our health department's the #1 public health agency in America. It's well regarded. It's well known as that. And they've been watching this situation closely. So we take very seriously if we see any information from a test that suggests there's a problem. We're going to isolate that part of the water supply in a school building. We will, if necessary, replace pipes, replace water coolers, take that part of the water system offline permanently if we need to. There's all sorts of remedies. But typically, that's not what we found. We find sort of momentary indications of a problem that do not manifest on an ongoing basis, and we don't have examples of kids getting sick from it. So to the question of how often we test and how reliable and how consistent, I will turn to Dr. Bassett, who can give you that context.
You are correct that the surveillance for elevated blood lead levels is among 1- and 2-year-olds. The reason for this is that the developing brain is the most susceptible to lead, and it's most important to identify elevated blood levels at that age. But we do always test if there's a concern about exposure. And we do have other sources of lead exposure that may affect older kids. Imported products that have lead in them, toys that have been painted with lead-containing paints. When we find these things and we're concerned about an exposure, that child may be tested. Apart from that, I think I can only reiterate what the mayor has already explained, that the water that arrives from our upstate reservoirs is tested 500,000 times. And it arrives pristine to buildings. The source of lead that may be found on these Department of Education tests is from the pipes in the building, most importantly from the solder that was used to put pipes together. And it leaches into water when water has been standing in pipes. And the Department of Education, whose testing strategy the health department has consulted with them about, uses first draw. When they find an elevated water sample, it's taken offline and remediated.
Mr. Mayor, how well do you think Chuck Schumer has represented progressive Democrats during the first 100 days of Donald Trump's presidency, and Democrats in general? And what cause do you believe of his that he's advocated has been his strongest?
I think he's been a fantastic leader. I'm thrilled he's in that job. And I am a proud progressive. Can't think of anyone I'd rather have leading the Senate Democrats than Chuck Schumer, because he is extraordinarily effective, and we need right now a master strategist in that job to deal with the overwhelming reality of an unguided missile of a Republican administration plus a more traditional conservative Republican Senate and a Tea Party-dominated Republican House. That's a pretty heavy combination. And to make sense of all that and fight back effectively, you need a really strong leader. I think he's been outstanding. Look, I think progressives need to recognize his capacity to marshal the fights that we need to win. And I think he played a key role in the effort to prepare to fight and win on protecting the Affordable Care Act. Ended up never even getting to the Senate, but he was front and center in the organizing of those efforts. I think that's a great victory for progressives. and the one I would point to first. But no, I talk to him all the time, and I really admire the way he's doing his work.
Anything you could do better?
We all could do something better. But in terms of the batting average so far, I like what I see. I mean, I think I think President Trump somehow in his imagination believed he would be having a first 100 days that might compared to the original, which was Franklin Delano Roosevelt. I think he's ended up having one of the weakest 100 days of any new president since Franklin Roosevelt. You're right. I mean, Franklin Roosevelt set the standard. Trump was coming up on 100 days, doesn't have anywhere near the achievement of other presidents to show for it. So I think you've got to, when something like that is achieved, you've got to look at the context. And Chuck Schumer deserves a lot of credit. Nancy Pelosi deserves a lot of credit. The grassroots movements deserve a lot of credit for the outcome. I like where things stand at this point in terms of fighting the extremist policies of this administration. Marcia.
Mr. Mayor, when you ran for mayor, you said you were very critical of Mayor de Blasio for lack of transparency.
No, I'm Mayor de Blasio.
I'm sorry, you were very critical.
I wasn't critical of him because he didn't exist yet.
When you ran for mayor, you were critical of Mayor Bloomberg for lack of transparency, and you said you were going to be the most transparent mayor the city's ever had. I wonder how you score that with your recent decision to cut back even further the amount of times you take questions from a group of people like the numbers of reporters who are here today.
Very comfortable that between these kinds of press conferences, the radio show I do every week, including call-ins, the television show I do every week, the town hall meetings, and then all sorts of other times that I gather with press, either individually or when there's other issues that come up. It's a lot of opportunities to be questioned, as it should be. And then all the officials of my administration and obviously my press office are constantly responding to things. We're held accountable for everything, and that's as it should be. And I'm communicating back and forth with the public on social media as well. I think that adds up to a lot. And I've told you guys I'm very proud of transparency. We've done lobbyist disclosure that no previous administration did. Didn't get a lot of attention, but I would argue that, the fact that I have always told you if I ever talk to a lobbyist about their business matters and put that online, that was a pretty big step forward in government. We obviously disclosed funding sources on any of the efforts to change policy, to achieve pre-K, to achieve affordable housing, et cetera. Plenty of people don't disclose where their donations come from. You know some of them. And I think that's part of being transparent. So I'm comfortable, and certainly everything we've done with open data, I stand by that we have a very open, transparent administration.
So is this a new Rose Garden strategy?
No, it's a strategy for communicating in lots of ways with the public, which is, you guys have a job to do, and I respect it, but the first obligation I have is to constantly inform the public. And there's lots of ways to do that nowadays, and we're using all of them. But do you think for a moment the people in New York City don't hold me accountable for anything and everything? I hope you were watching my Inner Circle skit. So it was somewhat facetious, but seriously, people are going to hold me responsible for anything and everything that the city government does, and that's fair. But we speak to them in many, many ways. Way back.
Mr. Mayor, actually, before I get to my question of the Campaign Finance Board, just to follow up on that, there's maybe 20 outlets represented here, and this group basically gets 20 to 30 minutes of your time a week, all those other factors notwithstanding. So do you think 20 to 30 minutes of questions with this group is enough per week?
Sure. I think the fact is that you can ask any and all questions and get answers all day long from my press office on where I stand on everything, which is going to make very, very clear what my views are on things and how we respond to problems and challenges and issues that are raised, and so many other members of my administration you're speaking to. I'm comfortable that that kind of accountability is there, and again, that's one part of it. You guys holding us accountable, and you do it all the time. It's also my obligation to talk to people, to let the people of the city know what we're doing, and we do that in a myriad of ways. Respectfully, this is one of many ways to communicate with people. They're all valid. What was the other one?
Campaign Finance Board, you've praised the system. Obviously, you're participating. There's a number of city council members who are not participating in the public matching system this cycle. It seems like in large part because they want to spend more than the out-year limits ahead of time. And there's some that are running for speaker that want to be able to give money to other city council candidates. We can obviously interpret why they would do that. What do you think of the fact that there's at least a handful, if not close to a dozen, city council members opting out of the matching program?
I'm surprised on the first part that you said they're because they want to spend in the out years. The law is that you can spend anything you want in the out years, but it comes off your ultimate spending cap. So just to be clear, if, for example, if the election is this year and you want to spend a ton of money in 2016, you can do that. That's not inappropriate, but you're going to have a lot less money in 2017. If that's their concern, I don't understand why they would want to opt out, because there's no reason they couldn't do that anyway. In terms of donations to others, again, people can make the choice. I would discourage it. I think it's a mistake. We have one of the best campaign finance systems in the country. I've said many times it's one of the reasons why I'm mayor is because of that system. I could never have raised the kind of money my competitors were able to raise. Only because of matching funds am I here. I believe it is a tremendous reform. I believe it's democratizing, and everyone should participate in it. So I don't want to prejudge people's reasons without hearing them. But if you said, is it the smart thing to do? No, it's not. I would discourage them from opting out. Way back. Way back. Yep.
Yes, thank you. 3 quick questions. One, there's a demonstration that was taking place this afternoon downtown at the HUD building, the No Cuts Coalition, over President Trump's proposed federal cuts to the public housing. That's my first question. Second, there's been a call for more police.
What's the question? How do I feel about it?
Feel about your reaction to that. Also, there's been mounting pressure from lawmakers, Governor Cuomo, Senator Schumer, about more training for police in light of the situation at Penn Station, rush hour last Friday. And finally, one more question. Letitia James was on MSNBC last night talking about the latest victim to come forward in the Bill O'Reilly saga. More pressure on O'Reilly to be fired. Your 2 cents on all that.
Time for Bill O'Reilly to go. Oh, I did not know that. Okay, that worked. Yeah. Wow. Do I get 2 more? No. I mean, the Bill O'Reilly thing. Look, I'm not the closest observer of Fox in any way, shape, or form, but it was clear in recent weeks that when that number of people come forward, unfortunately, we've seen this pattern before. But it goes back to a more systemic problem with Fox, and I've spoken about my views on Fox and News Corp before. This is a different matter. This is not their political orientation or their effort to push an ideological line. This is a broken culture. This is a culture that obviously allowed this kind of horrible activity and never created any consequence for it. So, the chickens are coming home to roost, that they're now all paying the price for a culture, a very unfair and inappropriate culture they created. On the question of the Penn Station incident, we tried very quickly to get the word out on social media that there was not there were not gunshots. There was not a reason to panic. We're going to work with NYPD OEM to really speed up. Everyone needs. I think this is the reality of the social media age. I think we're all coming to grips with it. You remember in a very challenging situation when we had the bombing in Chelsea, social media actually proved to be a very helpful tool in finding the perpetrator. But social media, like everything else in the world, cuts both ways. Unfortunately, it also enables panic in some situations. Part of the answer is the government agencies have to get the actual truth out as quickly as humanly possible. And it's a little bit chicken and egg, because sometimes they're trying to confirm the truth while these things are unfolding. But what I can tell you is we're dedicated, City Hall, NYPD, OEM, that the first moment we have confirmed truth, we're going to put it out on social media. I think the other thing is a human thing, that people, every one of us are human beings. If we sense danger, we're going to react. That's normal. But being aware that the panic can create its own dangers. So I think, cool heads in these situations have to be careful to see, is there any evidence of the thing that's being alleged before? I'm sure, training always helps, and we are retraining the entire police force all the time now, so it's the kind of thing we would work on refining, since it's a new reality people have to get used to, and officers need to know more about how to quickly reassure people and get facts in that we can get out. Remember, not so long ago, reporting those facts back to your commanders meant still a lot of other steps before it could get out to the public. Now you're talking literally the faster you can get it to folks who can put it out, could be a matter of minutes you can set the record straight. So I think it is smart to say that there should be more training. But I think the people, all of us, have a responsibility too to do our best to, not necessarily believe the first rumor we see, and be a little careful to try and get something official to back it up. The first one on the HUD cut, or they were at the federal building protesting the budget cuts, obviously HUD in particular. This could be a big fight. And I think it's another example where the president's bitten off more than he can chew. To put forward a budget that eliminates a series of initiatives that are deeply cared for all over the country. I think he's going to be surprised at the backlash. The Community Development Block Grant is a great example. This stream of funding pays for senior centers and Meals on Wheels and affordable housing and weatherization for homes of low-income people and all sorts of things that are in every city in the country. Every city, no matter how big, how small, every state of every persuasion. And for a lot of states, this is what's being left out of the equation. We're a city that has a lot of resources, relatively speaking, and we do have our ability to, because of income tax, for example, bring resources in directly to our city government. A lot of cities and towns around this country don't have anything like that. And one of the only things they can depend on is federal aid like the Community Development Block Grant. When you say you're going to take that away, you're going to have a rebellion in red states and purple states of local officials and chambers of commerce saying to their Congress members and their senators that, this is some of the only examples of federal support we get, and Donald Trump's going to take it away. That's not going to end well. Please.
I got a few. So John Kelly, DHS Secretary, said, I think it was last week, that marijuana possession is an essential element of ICE's deportation package. NYPD had 18,000 marijuana possession arrests last year. I'm wondering, do you think people should be deported, considered criminals for marijuana possession and deported as criminal aliens, be a target of ICE?
Again, I think we've been down this road a lot of times, so I'll try again. We're going to do what we think makes sense to keep our people safe. The issues related to immigration are very important. The first responsibility is to keep our people safe. So we believe the way we're set up now in terms of law enforcement is achieving that, and we have the facts to prove it in terms of constant reductions of crime. You know that in terms of low-level possession of marijuana, we moved away from arrest. You know that with the training officers are getting now with much more discretion and in many cases different options, arrest, summons, warning, etc., that our officers are choosing often to not go the path of arrest. But if there is an arrest, that typically is because of other factors involved, outstanding warrants or other issues. And even in that instance, we're not going to collaborate with ICE. Yes, the person's fingerprinted. Yes, the information goes to the federal government. But that still means ICE has to go through its own elaborate process of trying to find someone. And they can do that anyway in many cases, as you know. But we will not work with that because we have a clear law that doesn't permit that, and we don't want it to permit it. So I'm convinced we're on the right track. If we make a decision to approach any offense differently, it's going to be because of the public safety needs of New York City.
That second thing, different. Yet another construction worker last week fell off a building and died, not wearing a harness. The buildings commissioner came out and said it was totally preventable. More people obviously dying in this industry than any other in the city, in it by a large factor. What needs to happen?
We are working closely with the city council and the industry and labor to put new measures forward quickly. We put a series of changes forward last year that increased the amount of supervision on sites, increased number of inspections, a lot of things that we believe have helped, but still it is a shocking number of deaths and it's not acceptable. So we're going to have more, and I think that package is coming together quickly. Yes.
Just
follow up on my prior question. You said that you think Chuck Schumer has a good batting average or great batting average. What would you say his batting average is?
I don't give batting averages. This is not baseball. I think he's great. I just think he's doing a great job. I think I get the inference of your question, and my response, and I'm very comfortable in this, is I think he's doing a great job.
Last week we had a story in the Daily News about the increase in state troopers in the downstate area around here, including at airports. Some people saw that as part of this back and forth between you and Governor Cuomo. I'm curious what you make of the increase in state troopers, and also what you think of the current law enforcement status at the airports.
We welcome more law enforcement presence at the airports. Airport security is obviously controlled by the state and the Port Authority. We have very rigorous standards in terms of the NYPD, and we think it is appropriate to beef up security at the airports. So I don't think it has anything to do with the political dynamics or personality dynamics. It's something I'm actually very happy to see.
Separate, but going back to some of the earlier questions, do you enjoy taking questions from reporters?
It's scintillating. Laura.
That sounded like a dodge a little bit.
I thought it was a nice adjective.
I'm curious, you brought up the lobbyist disclosure that you do voluntarily and that you've done that. I asked at some point, I think a year ago or so, about your pledge as part of your campaign in 2013 to disclose agency-level lobbying. Can you say any more about what's going on with that? And also, I'm curious to know if you have any updates on when we would be getting the list of the donors who didn't get what they wanted.
This month, and it's not a list, I want to make sure it's clear, because Eric Phillips there has communicated that I think has been an interesting, what's the word I'm looking for? Mission drift or something like that. I didn't say that I had the perfect list of everybody. I said I wanted to give you examples when I first talked about this, that I felt that a really bad assumption was being made. And President Obama spoke about this back during the presidential campaign, that people give a donation, and that's all you need to know is they gave a donation, and there's got to be an outcome, and it's all very linear. And I really think, honestly, and with deepest respect for the role the media plays as watchdogs, you got to look at the reality of what's happening in all its nuance. What I've said consistently is people make a donation, and they sure as hell better not expect an outcome, because I got lots of examples where they don't get an outcome they want, and they get often the opposite of the outcome they want, because we're going to make decisions based on the merits and based on what we think is right for the people. So I don't have a perfect exhaustive list. I have examples for you, I think, illustrate the point that all of the inferences over the last year that a donation must lead to an outcome were really unfair to a lot of people in public life. And also there's glaring examples to the contrary that somehow don't get talked about. So what I will do, and I think I will probably do it in the form of an op-ed, Eric Phillips. I'd like to just tell you that. Someone tell Eric that I'm going to do an op-ed. I'm going to just give illustrations of some of the ones that I think are the most powerful examples to set the record straight that it's just not how things work.
First thing that I asked about, the lobbyists, the agency-level lobbyists.
It is a good question, and it's something I believe in, but I have to find out the status of that, so I will come back to you on that. Okay, let's go back. Who's the farthest back? Go ahead.
Well, if you're going to give us examples of people who didn't get the favors they asked for, are you also going to give us examples of people who did get the favors they asked for?
People don't get anything because of a donation. So you guys have spent plenty of time trying to make that allegation, and you've taken cases where someone made some kind of donation, and meanwhile back at the ranch, there was something that the government agreed with them on, and you've tried to make that endless linkage, and I've told you it's not a fair linkage. You've long since argued that case in lots and lots of column inches, all of you. I'm going to give you a bit of the counterpoint that I would love to see you report on. I won't be surprised if you don't. But no, I'm not going to, you've asked this before, I'm not going to go back over 3 years of administration and tell you how every single thing worked out. I can tell you a blanket rule. We don't do things because of contributions, period.
The federal prosecutor in his statement said that they had found instances in which donors seeking favors got the favors that they were seeking. Will you be giving us examples of donors.
No, I disagree with the characterization. I've told you that also before. I disagree with that characterization, and it's all over.
More.
Oh, wait, I'm sorry. You've gotten a little too much. We'll come back. Go ahead, Anna.
Yesterday you released your tax returns and they showed that you paid a little over $7,000 on your property taxes for homes that are worth well over $3 million. Do you consider this fair?
I think the entire property tax system needs to be reviewed top to bottom. There's no question that there's inequities in the tax system. I didn't create the tax system. You didn't create the tax system, but there are obvious inequities in it. And there's a lack of consistency across geography and across different types of homes. Now, I've said this in town hall meetings, including in the borough of Staten Island, in the previous one. This is going to be a massive undertaking, about as the most controversial thing you could possibly imagine. To open up the entire property tax system of New York City, shine a light on it, and talk about how to restructure it and to be more fair. And one thing I'll tell you up front, Dr. Bassett, you do not sound like you have a good health situation. You all right?
I'm all right. I just have a cough.
Is there a doctor?
Drink water, everybody.
But the other trick is we can't lose revenue in the bargain. We just can't. I mean, let's be real world about this. We have to take a system right now filled with idiosyncrasies and inconsistencies and still end up with basically the same amount of revenue. But I think there is a way to do that that creates more fairness. So, for example, you know that some neighborhoods have just seen these ridiculous increases because of the way their values have increased compared to others, and it doesn't create parity. We're going to have to address that. So I think it's quite clear that cannot be achieved in the remainder of this year. It's going to probably be, I would be shocked if it could be done in a year. It might be a multi-year effort. But if the people renew my employment contract, that is something I will be working on.
Okay, a couple follow-ups. Do you think what you pay now is fair, is what I originally asked? And also, are you delaying this because it's an election year? Why not start now if it's going to take multiple years anyway?
Because it's going to take multiple years. And, you know, if I'm here, I will govern over that process, and I'll get us to an endpoint. I've already committed myself to it. And if I'm not here, someone else has to decide how they want to handle it. At this point, it just doesn't make sense to start it when there's so many other things happening. It's going to be a very, very labor-intensive effort.
So it's not because it's an election year?
It's because it is something that's going to take so much effort and so much of the administration's time and energy that it's just not the thing we're going to do now. But if I'm around, I guarantee we will do it.
Okay, and the other thing,
I'm not going to speak to my personal circumstance. I don't think it's right. I think the question is the system balanced? Is the system fair across all geography? No. But that, I didn't create it. I'm part of a much bigger thing here, so I'm just not going to answer it as asked. Go ahead.
Paul Massey, New York One, did a story on his voting record and found that he only voted in 5 elections over 19 years and didn't vote at all over a 10-year period. I'm wondering, A, what you make of it, and B, if you think that voting records of candidates for public office are something that voters should take into consideration.
I think you should vote more. Yeah, of course. People who want to be in public service should vote consistently, and it's a perfectly valid issue, of course. Way back.
Mr. Mayor, the governor was proud of including in the state budget this flexibility based on the federal budget. I'm wondering if you are familiar with that part of the state budget, that he can adjust the state budget mid-year based on a certain amount of federal cuts to New York. If you're familiar with that and what you make of it, and any concerns you have for New York City that federal cuts will then trickle down to the city.
I'm not familiar enough. I don't fully understand it. I don't know if I'm alone in that fact. I don't fully understand it. You know, from our point of view, we would do that through a budget process. We would, you know, we have a normal process for budget modifications. We go to the city council, they vote on it. I don't understand, even though I know the legislature has more of a fixed session than the council does. That's true. But I don't fully follow the logic. I would think the normal thing to do would be, you know, set a course if those federal actions really fundamentally change things, to come back to the legislature and talk it through if it was major things. So I'm speaking as someone who doesn't fully understand what the vision is, but I think if it's a major magnitude, you'd want to work with the legislature to work it out. Go ahead. Okay, wait, I see 3, so let's do 3. Go ahead, Yoav.
Mr. Mayor, I want to follow up on something you said last week regarding Deputy Mayor Bury and the assistance he got from the DOE in getting his kids enrolled in school. You said you were looking into it. What does that mean exactly? Is there an investigation or what have you? And also, separately, just wondering if you're able to tell us how much money you owe in legal fees to Kramer 11.
They are still being gathered because their services only ended a short time ago. So a lot is the answer, but I don't know the exact amount yet. On the situation with the deputy mayor, there's a review going on. I don't have the chapter and verse on who's doing it. I do know it'll take a little while, but we can get back to you on how that's being handled.
Last week, we did a story about immigrants who told us that they would rather go hungry than risk deportation. These are families where the parents are undocumented, but the children qualify for food stamps. They're actually canceling their food stamp benefits, and in some cases, not showing up for food pantries, even though they're not government-run programs. So aside from reaffirming our status as a sanctuary city and pledging not to share information, is there anything else that you think the city can or should be doing to get the word out when people try to cancel their benefits, to try to dissuade people from doing this?
It's a very important issue, and I really appreciate that you have shown a light on it. We are worried about this reality. I mean, think about a family turning down food they need because they fear deportation. It's just sickening. And it proves how dangerous both the rhetoric coming from the Trump administration and some of the executive orders are, because if they're literally causing decent people, hardworking people to suffer, that's not what we're supposed to be seeing in our country. Our job is to counteract that. It's not just by vaguely saying, you know, we're going to be supportive and protective of immigrants. It's we have to get out in the communities, particularly through trusted intermediaries, houses of worship, nonprofit organizations that are part of the community, and spread the word that it would be horribly unfair to families to start stepping away from all the things that we offer them so families can be whole. We don't want to see parents not send their kids to school. We don't want to see people pass up health care. We certainly don't want to see them pass up food. We're not going to ask their documentation status. It's not going to put them in harm's way. They should not hesitate to keep taking advantage of the things that are there for them. And that's a moral statement and a human statement, but also if this follows through in the way that we see some of these signs, so what are we going to be left with? We're going to be left with children who are New Yorkers, who are hungry, who are less healthy, who are less educated, and then we will all pay the price as a society in every sense, including the taxpayers. That's how horribly counterproductive this policy is, in addition to being immoral. So we're going to try with every tool we have to reassure and show them that they should not fear in a way that causes them to do things that's harmful to their own family. We're also going to address the ways going forward that we can provide support if, God forbid, a family that didn't do anything wrong or did something very minor was threatened with deportation. There are ways we can support them. We'll have more to say on that soon.
So one is the once a week open Q&A that we're used to. Like, could that become once a month? Is there a certain obligation that you think, no, as mayor, this is my obligation to see you guys and do an open press conference once a week? And thinking also about the precedent it sets for other electeds and what you would want the president to do?
I think they're all different dynamics. I think presidents have done relatively few over time. I think President Trump is different than any other president. I think we can all agree on that. But in general, presidents do a lot. I'm not familiar with the latest on the governor. My impression is he has not had a lot of traditional press conferences. You can set your watch by the fact that we'll be doing this every week. just like you can set your watch by the fact that I'll be doing the WNYC call-in show and New York One. So I think for a city with so much going on that I have to attend to, this is a lot of opportunity to answer questions. And I said on top of that, there will be town hall meetings. There'll be all sorts of other interactions with media in one-on-one small groups or as issues arise, and then other ways I'll be communicating. You can bank on that. It's not going to change. So I understand the inference of the question. I'll say very comfortably, as long as I'm mayor, I'm comfortable with this standard.
And then just a second thing.
Yeah.
So in terms of particulate matter in the air settling in people's lungs and giving them heart attacks, have you heard about the issue of the burning of used motor oil in home heating oil furnaces across the city? Widespread practice.
No, I don't know. Dr. de Blasio, there's a new one on me. Do you know about this issue?
I don't know about that particular issue in terms of yes, particulate matter is a health hazard, and we'll look into that issue and get back to you.
Okay. Thanks so much, everyone.
Thank you. Nice to meet you.